Welcome to the Alphagenix podcast, where every week we talk to incredible guests from around the world of biohacking, well-being, men's health, and more. Here's your host, co-founder of Alphagenix, Ross Tompkins.
Hi, welcome everyone. Obviously, I'm not Ross Tompkins. I'm Dr. Max Draper, lead clinician at Alphagenix. And today I'm absolutely delighted to welcome back Dr. Andrew Winge. Hello, Andrew.
Hey, Max. Thanks for having me back.
Pleasure. So for those who didn't see the original episode with you, which I think was a couple of months ago now.
It's been a while.
Yeah. Would you mind just reminding people of your background, your day-to-day work nowadays?
Sure. Yeah. Obviously, you can tell by my name, I'm a traditionally trained MD. I'm board certified in family medicine and emergency medicine. I still work full-time in emergency medicine, but I also run the Man Medicine YouTube channel. I have a small private men's health practice that I run via telemedicine. That's quite small. It's really very much oriented towards health optimization, longevity, but also clearly like testosterone therapy is a large part of that for many of the guys that I take care of as well. So that's my true passion. I love emergency medicine too, but it mostly just pays the bills. What I really love is men's health optimization, etc. In brief, I got into this mainly through my own issues, just like yourself. We both had low testosterone, both actually had primary hypogonadism, if I recall. You had primary, didn't you?
Yeah.
And the struggles of getting through that, getting the diagnosis, and then subsequently learning as much as I could about it prompted me to want to help men with similar problems. So fast forward 14, 15 years, here we are.
Yeah. The dream team.
The dream team.
So I thought, who better? Because I thought this episode we were going to discuss about the myths surrounding TRT, which there are plenty, but also the kind of the other side to the equation, which is managing expectations. Because I think with the modern world, we have a bit of potential influence talking about being on TRT and having a body like Chris Bumstead, and then on the other end of the scale, we have potentially people seeing, maybe physicians and things and getting maybe wrongly scared away from TRT as well at the other end of the scale.
That's right. Yeah, there's patient expectations, and then there's also misconceptions and perhaps expectations for providers too. Those of us that have been prescribing testosterone for a long time, I think we have a good handle on what's realistic and what's not realistic. But certainly, like new clinicians might still have might still labor under some of the myths that are still persisting with testosterone therapy, things that I was taught in medical school and you were as well. It can take a long time to divest yourself of some of these, little ragtag bits of illogical and unscientific ideas about testosterone. I know it took me a long time. I was actually I wouldn't say I was anti-testosterone, but I was just willfully ignorant about the benefits of testosterone therapy for a huge part of my conventional medical career, all the way up into my mid 30s or late 30s when I was finally diagnosed. And it took that long for me to figure to at least begin to figure some of this out. And then you realize, of course, you go down the rabbit hole and you realize that most of the stuff that you learn in medical school and residency regarding TRT is completely wrong. It's not evidence-based, it's fear-mongering. And most of it, I think, in my opinion, comes, it's sort of spilled over from the bodybuilding world and from just these other misconceptions that are pervasive in society. I mean, just because you're a doctor doesn't mean that you're immune to being influenced by the popular culture and the myths that are in the popular culture. Can spill over into the medical community as well. The problem is people put a lot of authority and they listen to medical doctors. So if they hear a doctor say something or perpetuate a myth, it carries a lot more weight, and it's much harder to get rid of that.
And it's quite hard on our end of the equation because
we have to do a lot of work.
Another doctor's telling them two opposing opinions of the same, for example, we could talk about cardiovascular disease risk. And a lot of patients will come and say they've been told that TRT will give them a heart attack, whereas actually when you actually look into the science and say, well, low testosterone increases your risk of a heart attack, but TRT is potentially beneficial, at least neutral from the majority of the studies.
Yeah, that's absolutely right. And that's actually what's kind of interesting about the myths that we learned in medical school is not only were they wrong, but the truth was actually the opposite of what we learned, right? You can absolutely say that, for example, with prostate cancer. We both learned, because that's another myth, that testosterone not only causes prostate cancer, but if you have an active prostate cancer and you add additional testosterone beyond the patient's baseline, then it's the gasoline on the fire is the analogy that we learned, that it still gets perpetuated. Although thanks to guys like Dr. Morgenthaler and Lipschultz, and there's a whole host of sort of pioneers in this field that have pretty much put the final nail in the coffin on that one. I think that one's getting better, but there's still some holdouts, and maybe some old school urologists that and endocrinologists that are afraid of feeding a prostate cancer. But the data in that area is pretty clear that that's not the case. And I certainly, like, if I ever got prostate cancer as an older man, I would not be afraid of testosterone therapy once, under specific circumstances, which are probably beyond the scope of this talk. But there's it's no longer like completely forbidden and no longer considered medical malpractice to at least consider it. So
so it doesn't increase risk, and even in certain circumstances, if someone has prostate cancer, they're still considering it for particular patients. It's quite crazy how it switches. I was like you, when I was obviously a GP for a best part of a decade, and when I went on TRT, I remember actually thinking, I have no choice here because of how bad I feel, but I'm going to have a heart attack by 50 and I'm probably going to get prostate cancer. I literally remember having those thought processes in my head.
You have to weigh the two, like, what's it going to be?
But then when I actually started to learn more about the topic, I realized actually I'm probably reducing my risk of many things. So we touched upon, should we, any particular myths or anything that springs to mind beyond the prostate cancer and cardiovascular disease?
Well, just a couple more things on the cardiovascular one is a big one, because it also encompasses blood clotting and things like that. And so as far as, heart disease, which heart disease is a very broad term, but I suppose when I'm talking about heart disease, I'm thinking of mainly like atherosclerosis and the traditional myocardial infarction, from plaque, et cetera. And you mentioned that it's at largely neutral in terms of our lipids and things like that. The guys in my panel, because I aggressively hammer home the idea of lifestyle modification in addition to TRT, if you were to look at my panel patients, and I know it's the same with yours as well, their lipids improve dramatically on TRT, but it's largely because of the other, the lifestyle, diet, exercise, et cetera, changes that they're making. Certainly testosterone can help with triglycerides. It helps, obviously it helps with insulin sensitivity, which is intimately tied in with triglycerides, but it's hard to tease apart the dietary changes that our guys make. But if you're just a bump on a log and you don't change anything about your lifestyle, don't change anything about the way you exercise and the way you eat, et cetera, and you don't make a concerted effort to lower like visceral body fat levels and things like that, you're not going to expect major changes in your lipids, either positively or negatively. They'll probably just continue to get worse as they would have had you never been on testosterone, with the exception of maybe your triglycerides, getting a little bit better. What I have found interesting about TRT, and it's buried away in the literature, but it certainly is there, is how important or how impressive testosterone therapy can be with symptomatic heart failure. And I'm not talking about the kind of heart failure I see in the emergency room where they're completely decompensated and, you clearly don't give testosterone to someone who's massively volume overloaded. But once these people are stable and they are on their traditional drug regimen, you can improve exercise tolerance, walking distance, and again, all the parameters that go into overall quality of life by treating low testosterone in patients with heart failure. And that used to be something that was sort of scary, and people really were not sure if that was the right thing or not. But there's really good data that treating a low testosterone level in a man who has stable heart failure can really improve their quality of life, can make a big difference. And I don't know if it's going to extend their life. It probably is neutral in that regard, as long as it's done properly. But as far as exercise capacity, sexual functioning, and just overall quality of life, yeah, absolutely. And the mainstay of treating heart failure, besides the drugs, obviously is exercise. You need to get out and exercise. And if the testosterone gives you a little bit of a boost, even if it's just a psychological boost, and improves motivation, which we know it does, then that's a great thing. So I'm not afraid of using testosterone at all. And I do it prudently, obviously, in men that have heart failure, but that used to be completely off limits as well. And that we shouldn't do that. So
yeah, 100%. Well, it's like you said as well about the heart disease side of it. So maybe at worst, I would say it's neutral. I think, like you correctly point out, if you give that guy, if he's got poor levels of testosterone, he ends up feeling more energetic, being more stress resilient, sleeping better, recovering from exercise more. And then you add into that, look, stop being a bump on a log, get out there, hit the gym, do your resistance training, do some cardio, sort out the diet. I have all the confidence in the world saying that we are reducing cardiovascular risk.
I think so too. I think so too. Yeah, it's often a missing adjunct. The way that I look at testosterone in a maybe a slightly different way that other people do, but because I'm still in the mainstream medical world, I see how serious some of these chronic medical conditions are. Uncontrolled diabetes, poorly controlled heart failure, chronic kidney disease, and chronic anemia of chronic disease, which is now anemia of chronic inflammation, I think they're calling it. But all of these things, I would like to have every tool in my toolbox available to treat those, and that includes hormones. And so, I don't want to have limitations put on what I can use on it for a particular patient. And if somebody is maxed out on all of the traditional, pharmacological interventions that we use, yet are still suffering, are still not doing well, and I have a feeling that adding testosterone in could benefit them, why wouldn't I do that? Almost, I'm not going to say irregardless of their T level, but even if they don't qualify for the strict definition of hypogonadism, there's still a reasonable chance that they can benefit from that. And I know we're talking about TRT, but this includes thyroid hormone too, in reasonable doses. There are medical conditions that can improve with these modalities, but they just because of some of the misconceptions that we'll get into more, I think clinicians are a little bit they're a little bit gun shy about using them. And it's I understand if they don't have the training. I didn't have the training initially. You didn't either. We had to go out and find it, and then build up many years of clinical experience using these to know what's safe, what isn't, etc. So I just want all the tools. If I've got an out of control diabetic, I want everything's on the table, and that includes hormones.
Yeah, we have a general fear of hormones in the medical world, and that will spill over into the general public as well. What I wanted to ask you, because I've never quite worked it out myself, do you ever work out why people assumed that testosterone did increase cardiovascular risk? And the reason I mention that is that there's been so much research on this topic. When you look online, in terms of papers, is it at least, there's been so much. There's been papers done and multiple papers. Why was it that we assumed, or we kept having to reinvestigate the issue? Do you know what I mean? Because I didn't quite understand it. Is it because of bodybuilding linked with heart disease, or?
I think so. I think that's where it came from. It's funny you mentioned that. If I can spare the time this week, I'm going to put out just a fun little video. I found some cardiovascular papers from the late 1930s and early 1940s where they were treating exertional angina with
Yeah.
with daily injections of testosterone propionate.
Yeah, seen it. Yeah.
Yeah, you've seen that. Yeah.
Yeah. Yeah.
And this was way back, I would clearly way back. And they were praising the ability of testosterone to improve walking distance and reduce angina in men who presumably had really severe coronary artery disease. I mean, back then they didn't have caths and angiograms and whatnot. But so there was a point where I think the medical community was a little bit more open to it, or at least the subset of cardiology. And then, yeah, something happened. I agree with you. I think it's probably the bodybuilding and sports performance world. There was a lot of backlash in terms of like Olympic athletes.
Just lost you there.
Okay, you got me.
Yeah.
Okay.
Yeah.
All right, we're back. Anyway, back, in with like Ben Johnson and Carl Lewis back in the what was that, the 88 Olympics, I think. I can't remember. So, it was massive public backlash. And then Joe Biden putting through the Anabolic Steroid Control Act around that time with the baseball scandal. So there was just like massive negative press about performance enhancing drugs that unfortunately spilled over into the medical world. And obviously doctors watch the news and watch television just like everybody else, and I think that a lot of that got soaked into their head. And then so here we are. So now it's taken 20 plus years of research contradicting some of those claims to at least like get the ball rolling, and now meaning physicians, are a little bit more open to using it. But I think that was a major setback, that kind of anti-doping, anti-PED thing that was all over the news 20 years ago.
Yeah,
it did a lot of harm, unfortunately. And then on the women's side, the WHI, Women's Health Initiative, did a lot of damage as well for women in terms of estradiol and progesterone and things like that. And like, we're still trying to dig out from that. So
yeah. And things take a long time to switch over.
It takes forever. It takes forever. It's it's shocking. I mean, I have a good friend who is a veteran like I am, and his VA doctor. And again, I'm not trying to bash the VA here, but he looks like a young, healthy, fit guy. I think he's in his late 30s, but his internist just flat out refused to check his testosterone level. So there is in some circles just resistance to even checking it. Which is absurd to me. He had classic symptoms. And so do you know what his total testosterone, when he went and got it on his own, it came back at about a total of about I think it was 128. So shockingly low.
That's like 4 or 5 R units, or about
it's obscene, like dangerously low, in my opinion. And this particular physician, and who's will remain nameless, of course, just would not even entertain even checking the test for this guy. And it came back pathologically low. Anyway,
well, I'm sure we could give many stories about circumstances like that, couldn't we? It's quite crazy. What about that then, about the link with the anabolic steroids then? Because we were talking offline about expectations, and maybe maybe part of the myth is the other end of the scale, as in we both talk about how life-changing TRT potentially can be, but managing expectations is important. And probably because of that link with performance enhancing drugs and things, is managing expectations at the other end of the scale. So we talked about like the common scarier myths, but the other end of the scale is actually people looking at TRT like it's going to solve everything, but also turn them into like this jacked monster with 5% body fat and muscles bulging.
Right.
How do you go about managing that other end of the scale?
We have social media, I think, to thank largely for that. But there's another aspect to that too, is because testosterone levels are dropping so dramatically in the population. Now we're getting younger men who are coming to us, overtly hypogonadal, and it's the younger generation that are more influenced by social media. They grew up like they don't know a world without Facebook. Many of them don't know a world without Instagram. I mean, I'm old enough. I grew up in a world without computers. We didn't have a computer in my home until I was 17 or 16. And it was great. In hindsight, there were some advantages to that. So yeah, they see all these Instagram influencers and Facebook pages and all this different stuff that shows these jacked, ripped guys, and they think that that's just on the other end of a few weeks of injecting testosterone cypionate for them, and that's, I mean, it's clearly not the case. I even in my panel, my men tend to be a little bit older, but I still field questions about, hey, I really want to put on some muscle tissue this year. Can you recommend a SARM? Can you recommend, X, Y, or Z supplements, or can we tweak my dose, etc.? And so we have to have that conversation that, in the vast majority of cases, the reason that you have the physique that you have, or that you're not putting it, or you're not getting the gains that you think you should have, the rate limiting step is not your T level, it's your dedication, it's your consistency over time. These things don't happen overnight. I mean, it takes years, even in the prime of your life, as a teenager and in your early 20s, when you should have a solid, robust T level. It takes years to put on muscle tissue. If you could put on, as a young man, if you put on 5 to 10 pounds of muscle tissue in a year, you're doing really well. This is, if you have just average genetics, there are outliers who just blow up, and we all hate them, but that's genetics. They're taking genetics aside, it's important to dial back expectations. And the studies are pretty clear with muscle building and testosterone levels. It really does. If you want the big gains that you see on social media, those are super physiologic doses that's not TRT. That's not what we're talking about. There's there's studies showing like 600 milligrams a week is what will give you these, the biggest gains. And the changes between, 50 milligrams a week, 100 milligrams a week, and say 300 milligrams a week, those aren't big differences in muscle tissue. It's only when you start going 600 and above that you see these massive gains that these Instagram guys are not, they're not really being totally transparent as to what they're taking. But people see that and they're like, if I get on TRT, I'll look like that.
Yeah.
And it's not only the drugs, of course, and it's the high dosages, but you also don't see the years and years and years of hard work that those guys put in. The Chris Bumsteads of the world dedicated 10 to 15 years living as monks, basically. And so you do sacrifice a lot to become, if you want to have that kind of a physique, you're going to be giving up a lot in other parts of your life. And you just have to, more power to you if that's what you want to do. But I guess what I'm trying to say is it's not the hormones as much as people think. It's the hard work. It's the day in and day out grind. And we live in a I want it now society. Everybody wants a quick fix, and they do sometimes look at TRT as a way of shortening that road for them. But granted, it is easier to build muscle with a normal testosterone level than it is when you're hypogonadal. Nobody questions that, but that's not the rate limiting step for many guys. It's the consistency, it's the discipline, it's the day in, day out grind that will get them the physique that they want. And the TRT obviously will help with that, but there's just so much more to it. And nobody wants to do that. Nobody wants to talk about it. And again, in the younger guys that I see, that's a lot more pervasive. The older guys, you can probably back me up on this. Many of them, they're just like, I just want to feel better. Granted, I want to lose a little bit of fat, but at the same time, I want to have sex with my wife. I want to not be tired at the end of the day. They're a little less focused on being, ripped and jacked. But the younger guys definitely want that And I have to have that conversation with them. Like, this is, you've been lifting weights for 6 months. You're nowhere near your genetic limit, and you don't even know how to train properly. When I ask them about their training programs and what their diet is, it's garbage. It's like, of course you're not making gains, and it's only been 6 months.
Yeah, I mean, that's the thing you don't see is the time and the stuff off the social media, exactly like you said. It's kind of like saying TRT can help body composition changes. We know that, it can help reduce fat, visceral fat, which is obviously important for living a long and healthy life, and gain muscle. But it helps you get to a point of being healthy, and you can be, you can gain a reasonable amount of muscle, but it's time and everything else that is hugely significant,
Absolutely. Absolutely.
I always go back to my own, story, being on TRT for several years now. It's kind of like, I haven't put on a huge amount of muscle, I wouldn't say. I'm not looking massive, but I've lost a lot of fat. But that's predominantly because I've got more energy, sleeping better, making wiser decisions in the kitchen, and just feeling more motivated to go to the gym from TRT compared to where I was.
Absolutely.
So
Absolutely.
The biggest benefit for me has been actually probably leaning out more than actually gaining a huge amount of mass. Yeah.
I agree. People are sometimes surprised when I say this, but I've lost muscle since I started TRT. And what I mean by that is I think I was blessed with slightly better than average genetics. When I started lifting weights in late in high school and got really into powerlifting in college, I blew up to, my off-season powerlifting weight was 255 pounds, 260 pounds, put on a lot of muscle tissue completely naturally. And then it was only later in my mid 30s that, I developed primary hypogonadism, and then I started suffering. But even then, I was still exercising quite a bit. I was starting to lose a little bit of muscle tissue because my T levels had gone down to about 300. But the main issues were all above the neck, I always say. So it was fatigue, brain fog, low libido, ED, all that kind of stuff. But the muscle performance was not great, but it certainly was still there. But what I think TRT has done for me now, as a guy who's 51, is it's allowed me to hold on to more muscle tissue than I would have had I not been on it. And I think it's also helped in terms of, again, not putting on as much body fat. So it has slowed the decline, I should say.
Yes.
It didn't make a big difference. I was already pretty jacked and pretty lean. And I think if anybody had looked at me in my mid to late 30s, they would not have, automatically said that guy has low T. I did not look like I had low T, but I certainly did. However, I think that if I had not been on TRT by this point in my life, I would be a disaster. I think I would look as bad or worse than the average 51-year-old. And so that's where I think TRT has helped me. It's really slow. It does not plateau the decline. We're all going to get older. We're all going to age. We're going to suffer the consequences of aging. But I think it has really flattened that curve a lot for me. And that's where the beauty is for older men. Is it if you do? But again, I'm not like Chris Bumstead. I'm not a monk, but I'm very disciplined. I don't miss workouts. I train a lot of jujitsu, and I do my best to eat well. And all of that together with the TRT has flattened that curve for me somewhat.
Yes.
So that's what I tell guys. I can't reverse the clock for you, but I can certainly flatten that because that decline is, certainly after age 50, it really starts picking up, and we want to flatten that out as much as possible. And that TRT, I think, is a big component of that.
Yeah, 100%. Well, it's like that we develop anabolic resistance as we get older, don't we? So it's harder to gain and keep muscle. And TRT is, your hormones are one part of that. They're not the whole picture. And obviously the lifestyle can help as well. So that's important for managing those expectations in terms of it can make a difference to body composition, but don't look on social media and put in the work as well.
No,
Yeah.
exactly.
Yeah.
It can take, there's a good paper that if there's any clinicians out there that want to look into this a little bit, or patients too, that, that like to read scientific articles, European Journal of Endocrinology, 2011. It says onset of effects of testosterone treatment and time span until maximum effects are achieved. And it does a really good job of setting expectations for how quickly things are going to happen, because you hear it all the time. Hey, I'm 12 weeks into TRT and nothing, I don't feel any different, etc. Well, that, depending on what you're looking at, that can be entirely normal. It can be entirely normal. Not to mention the fact that your protocol might still require some dialing in, so to speak. I tell guys, I mean, really, it's like a year. It can take a full year to reap all of the benefits of TRT, and for me as your doctor to really make the fine adjustments to get you as good as I possibly can. In addition to you doing your part, obviously in the lifestyle part of things. But again, this is a really good paper if people are interested in it. It goes through the expected changes like in body composition and lipids, in glycemic control for those of you who are diabetic and pre-diabetic, and there's a lot of you out there. The take-home message, without going into details on this paper, is things take a long time. They take months to at least a year, if not more, to get the full benefits. A big one is sexual function, right? Like, so guys come in with complaints of ED, super common complaint, and it's natural for a layperson to equate testosterone with erectile dysfunction. But the fact is, like, the ability to get and maintain an erection is it's a hydraulic phenomenon. There's a lot of plumbing and pipes and whatnot involved. It's not just a hormonal issue. So they are sometimes really discouraged when 8 to 12 weeks into TRT they still have erectile dysfunction. And so I try to have that, if that's one of their primary complaints, I really try to have that conversation as early as possible. That can be up to a year, and often sooner, but it can be 51 weeks, 52 weeks, depending on the article, before you see like it's sustained improvements in erections. Now, the morning erections, like the so-called morning wood, that picks up a little bit sooner. That can be within the first 8 to 12 weeks in some cases. Certainly libido, the CNS effects of testosterone tend to kick in much more quickly. The brain fog, fatigue, the libido is like the one that's classically studied. And I think you and I can both vouch for that. It was probably placebo for me, but honestly, within the first week, I felt like my brain fog cleared, and the dark clouds parted, and the sun. Sort of silly analogy, but I mean, I immediately felt better from that standpoint. And so that sometimes happens, but even then, I don't tell guys that to expect that. I want them to be patient with it. But the erectile dysfunction is a big one, and it's there's a lot that goes into that, including subclinical atherosclerosis, which
sometimes we got to wait for, not wait necessarily, but alongside good lifestyle, you've got to allow the testosterone to undo some of the low testosterone damage.
Correct, exactly. And that damage didn't occur overnight, and it's not going to be reversed overnight. So that's actually a great point. You can tell guys, look, so it took you 15 years to get into this condition. You cannot expect injecting the testosterone a couple times, 3 times a week for even a year to undo 15 years of damage, if not more than 15 years. It's just not, no drug can do that. It's totally unreasonable to expect that. So it's, and that's why it's important to treat low testosterone early. You got to get on it.
You reduce the damage of it, both mentally, physically, and sexually, in terms of the deep down physiological and psychological changes. I like the way that Dave Lee talks about the 3 milestones, 6 weeks, 6 months, and 6 years. It's because there is that benefit of having healthy levels of testosterone exposure over the years as well.
Absolutely.
And like you said, one of the there's so many benefits in terms of psychologically, physically, sexually as well. So it's hard conversations to have, particularly like you said, when people will pick up from what you said about timescales, is libido often picks up before erections. So that can be a bit of a bugger.
That's a frustrating combination right there, right?
Yeah. So that might be where you consider adding in things like daily Cialis,
Absolutely. I have that conversation, if not on the first visit, certainly by the time we have the second visit, because if ED is one of their major complaints, and it usually is, absolutely, it's the non-sexy stuff is what, if a man wants to, if you want to maintain erectile function like as long as possible into your 80s, guess what? It's cardiovascular health. It's the health of the pipes and the blood vessels in the heart. And so people are surprised when I mention things like or not just tadalafil, but telmisartan, in some cases, lipid lowering drugs, statins, ezetimibe, et cetera, to maintain erectile function. You have, if you have a pudendal artery that's clogged, or a penile artery that's clogged, which, by the way, I mean, those arteries are 1 to 2 millimeters in diameter in most men. It does not take a lot of plaque to cause a flow limiting lesion there, which is usually 50%. So it doesn't take very much, and all of a sudden now you've got a problem there, because it's tough to reverse that. So that's where it can take time to make the body, will make collateral circulation around an obstruction. You'll see it all the time with the heart. Somebody has a long-standing blockage over years, the body will sort of grow new blood vessels around that lesion to perfuse, all the tissue distally. And this is the same in the penis and in the pelvis. It's just that takes a long time. And it turns out that testosterone is actually a part of that, in terms of angiogenesis, and then also like nitric oxide production, et cetera. So you have to do a lot of other things in many cases. If a man has severe ED, testosterone is just like the tip of the iceberg. You've got to go into their metabolic health is extremely important. And if you don't,
anything good for your heart is good for your erection.
Isn't that interesting? Yeah.
Easy way to think about it, isn't it? So do your cardio, control your blood pressure, and look at all of your overall cardiovascular risk.
There's I trained with some really good cardiologists, and every specialty thinks that they're the most important one, obviously. But the cardiologists do have a good point. If you want to avoid Alzheimer's and dementia, do what's good for your heart. If you want to avoid kidney disease, make sure you take care of your heart. And absolutely, it's true. If you want to maintain erectile dysfunction, do what's good for your heart, and you'll go a long way towards doing that. And obviously, then the testosterone can be a very useful adjunct. But if you just rely on testosterone, many men are going to be disappointed in that department. So,
well, as well, you've touched upon like the timescales as well. But what we should probably add is how individual everything is. Like you said, it's so variable, isn't it? In terms of that's like a good guideline to give the guys. But then you can see certain people who come back after 6 weeks and they've had life-changing results. Whereas on the other hand of that, like you quite rightly said, after 12 weeks, some chaps haven't noticed very much. And
that does happen, more often, obviously, than I would like it to happen. But and those guys, it's particularly disappointing for them, because oftentimes those are the guys that they've been suffering for a really, really long time. They finally got up the courage to go in and see somebody. They got started on therapy, and they're 6 months in, and there's just the needle hasn't moved at all. And that's a tough one, because many times sometimes it's a protocol issue. But the other thing I say too, and I always think about this, is we're in the TRT world, and so there can be a tendency, the old saying about if all you have is a hammer, then everything looks like a nail. And so you always have to step back. If you want to be a good clinician, you always have to kind of revisit, do I have the right diagnosis? Do I have the right, are all this constellation of symptoms, which again, for men with low T, they're very non-specific. Am I missing a thyroid issue? Am I missing do I have undiagnosed sleep apnea? These are just some of the very basic things that really should have been checked early on, but obviously they don't always get checked. Is there some other underlying, genetic or metabolic disorder that I've missed that really is the true culprit here? And adding more testosterone, the reason it hasn't worked is because it was never a testosterone problem in the first place. So, and even in those cases, TRT, I mean, testosterone can help with those things, but it doesn't necessarily fix the underlying issue.
Yeah.
So that's just part of being a good clinician. And I, in the emergency department, I do that all the time. If I've got a patient that I think is a COPD exacerbation and they're not getting better with classic COPD type treatments, I step back and say, am I missing something? Am I missing a pulmonary embolism here? Am I missing, cardiac ischemia? Am I missing something else? And sure enough, a lot of times I missed something that I should have picked up on earlier. So it's always good to step back and not be like the government when something is not working, just double down on more of it.
Put more money into it.
You just need to put more testosterone in, and that's not always the answer, right? That's the government strategy for things that don't work. We just do more of it.
Yeah. I wish it was the answer, but sadly it's not always the case.
It's
more. And that's probably another thing for people to understand as well, is that more testosterone is not always better. So you'll have a threshold, and often if you go above that threshold, you'll actually feel negatives. Some people could even feel like they have low testosterone again. They feel anxious, tense. Their erection quality can go down, can't it? If you've got too higher levels, it's kind of like
too. It's a bit
counterintuitive,
but there is a sweet spot for optimal health for all of these, for every hormone and for almost every health parameter too. And if you exceed that, some men will be able to tolerate that. There's obviously bodybuilders that tolerate more than a gram of testosterone a week, and they do just fine. And then there's people that if they exceed 200 milligrams, they're having a nervous breakdown. And their anxiety is through the roof. So these are genetic differences in the CNS with neurotransmitters and transporters and things that are way above my head. But we've both seen that.
I've certainly found the case that if I have been higher in the past, I didn't like it. I just didn't feel as relaxed when I wanted to be relaxed and things. So there's so much individuality to it. That's why we kind of tackle it in broad strokes, but there's always that individual variation, which is why, like with your work and how I do it as well, the knowledge, but then you've got to apply it to that individual at the time, and you could always reevaluate what you're doing.
That's the art of medicine, right? That's how you know a good clinician. You and I look at scientific papers all the time, but then the real challenge is, okay, how do I, or even can I look at this paper and does that apply to this person sitting in front of me? And it doesn't always. And that's where you have to have just, really good communication with your patient and take a good history, ask a lot of questions, and most importantly, just listen.
So, you seem quite nosy. You can seem quite nosy.
I'm obnoxiously nosy. I want to know everything. Because especially if you're doing things via a telemedicine platform, you don't have the benefit of an in-person visit where you can pick up on a lot of subtle cues and things like that in the interaction, and obviously able to do a physical exam. So you just have to ask a lot of questions, and also you have to know when to shut up and just listen to patients, which is a big reason why you and I are in this space, because when we were doing our traditional primary care practice, I don't know how many minutes you had for patients, but I was lucky if I had 10 to 15 minutes to talk to somebody. And I don't care how good of a doctor you are, you can't do a good job in 10 to 15 minutes on anything, other than maybe an ankle sprain. And that's about it. A cough or cold, maybe.
So I had a list here as well from the team at Alphagenix, because when we do what we call a discovery call, they'll often get asked questions, and some of them, we've touched upon heart disease, prostate cancer. There's a few weirder ones that they've been asked by. So this is a reverse of what you often get asked about, actually, is one chap asked, will I regain my hair if I go on TRT, as in up here?
Oh, absolutely. Yes, absolutely.
Yeah,
Without question.
yes.
Yeah. I can, unequivocally, yes.
Yes, yeah.
Yeah.
Well, me and Andrew are waiting. Yeah, my hair's thin.
What I mean by that is, you will regain your hair. It just won't be on your head.
Yes.
Yeah, exactly. So some men do get some, their beards will fill out, especially if they've been androgen deficient for a long, long time, or some of these younger men who never achieved a high androgen level in their teens when they should have. Then there's that sort of like secondary puberty sometimes that can happen. So my beard actually filled out a little bit within the first 5 years. You might notice a little bit of extra back hair. I'm starting to get the old man ear hair. I think that's just mainly aging.
Yes.
So I have to keep an eye on that. But as far as this,
I've got random eyebrow hairs now, very long eyebrow hairs. I blame testosterone for that, but I'm not sure if that's testosterone related. But
I don't know. But
I'm
sorry, there's no cure for baldness.
No, more. I've definitely noticed a little bit more body hair and thinning on top. But we should probably add to that. It's kind of like that is largely genetic driven male pattern baldness.
Absolutely. Absolutely.
So testosterone replacement treatment increases DHT, which is part of the process, but
but not the only factor, obviously. But you hit the nail on the head. There's sort of like, embrace your fate. If you have the genes for male pattern hair loss, obviously there are things you can do to mitigate it, to slow that process down. But I'm willing to bet no matter how many thousands of dollars you spend on PRP injections, transplants, DHT blockers, by the time you're in your 70s, you're probably going to be bald. And I get it. Like if you're a young man in your 20s and you're in the dating market or you're single, and it can be very distressing to lose your hair at that young of an age. So it's very, it's sort of easy for me to sit back and, sort of poo-poo that, but I don't mean to do that. I understand psychologically it can be really devastating for a guy to lose their hair, but there is, there is some sort of, at some point you just, what is it? Amor fati. You got to just love your fate. I was fated to have male pattern baldness, and I didn't even notice. I didn't have any of it until my 40s, late 40s, actually. And then it just went out. And then I went back and looked at old family photos of my grandparents. And sure enough, and even with photos going back even further than that, I'm starting to look very much like my great grandfather.
I'm the same. It's like all of I won't say this because some of my brothers might watch this. So not all of them, but a lot of us have thinning hair, and my parents and grandparents, absolutely. So genetic destiny.
It's a small price to pay though, right? Like I would rather have this than be hypogonadal like I was.
100%.
It's not even a question.
Well, when I went on testosterone, I thought I was going to have a heart attack at 50. I still chose it.
You still chose it, right?
Yeah.
I'd have to think about that one, but I probably would still choose testosterone.
What about the other one that they get asked about is, will they grow breasts? So gyno. And I suppose that leads into estrogen, but it'd probably be a too big.
That's like a whole separate podcast.
Right?
Well, So the short answer is, obviously nothing's ever 100%. There's always outliers, but the probability is, especially if it's a properly done TRT protocol, that you will develop true gynecomastia is exceedingly low. And this is the problem, is that many men, they don't understand what true gynecomastia is, which is a development of glandular, thick, hard glandular tissue. It's not fat in the nipple area, which many men have already. It's not the transient puffiness, itchiness, soreness, discomfort, etc., that can be a normal part of the initial hormonal fluctuations that start with TRT. That's not gynecomastia. It's just not. That's not the hypertrophy and hyperplasia of true glandular tissue. So men that have true gynecomastia, when they begin TRT or at some point during their TRT journey, many times in my experience, if you ask them as teenagers, they had it. And it was an issue, and then it kind of went away. And ultimately, it is largely a genetically mediated thing. Estradiol is involved, but you know what? So is IGF-1, so is prolactin, and so are probably a host of other factors that maybe we don't understand that well. There's studies out there showing an association between adenovirus infection and gynecomastia. So there may be these environmental things that we don't even really consider or are not well versed on that are playing a role in the individual that's sitting in front of you. And so, I don't. That's not a concern of mine as a clinician. I know it's a concern for patients, and so I do try to address that on the first visit. Very, very, very unlikely that that's going to be the case. And ultimately, I mean, if you have, it's just like with the male pattern hair loss. I mean, if you have a gene or a set of genes that predispose you to gynecomastia, I mean, I'm sorry, but surgical treatment that's the definitive cure. You don't want to be on a SERM the rest of your life. You certainly don't want to be on an AI for the rest of your life to manage that. It's much safer and it's in your best interest, I think, to get that surgically corrected if you have true gynecomastia. If it's mainly just adipose tissue, well, then you know what you have to do. You know what you have to do. You have to, stop being a fatty. Get your body fat down. And you know what? If you have these pockets of resistant fat, which some of us do, then, I mean, that's a surgical treatment as well. So
get on the bench press, build the,
I mean, that will help. That will help. Right. Yeah. Put down the donuts and get on the bench press.
What about the similarities? I think this comes from the association with anabolic steroids. Will TRT give me sort of like a roid rage or acne, that sort of thing?
Yeah.
This must be coming over from the bodybuilding world. This was a list that I got given from the team. Acne is one that you do sometimes see early on, isn't it? I think.
It is. Yeah, it is. I still get a couple. I still get some breakouts. And again, I think there's obviously a genetic component to this too. As a teenager, I had really severe cystic acne on my back, and it would flare up during football season when I would wear the football pads here in the States. And I was never on Accutane, but I probably should have been. So I still occasionally at age 51 get the occasional pimple. But I've never had great skin to begin with. So
there's a large genetic component. I think there's a lot of data now or thoughts about inflammation as well driving a lot of the acne process.
There's definitely a dietary component to it. I'm not an expert in this area, but I will tell you, when I go on ketogenic diets, my skin clears up within a few weeks. And so, and I'm not the only one that I've heard talk about that. So I'm not exactly sure what the mechanism is, but that is a phenomenon.
With my weight loss as well, I've certainly noticed that I would get a lot of pimples on my back, and then that's pretty much cleared up unless I change something with my protocol. I might get some temporary issues there.
Yep.
And this is a personal annoyance one for me. So this will be the last one, I promise, is joint health. So I sound a bit angry, don't I? But that's because I am. I've had a couple of patients who have seen joint doctors and told to stop their TRT because it's bad for their joint because they've been diagnosed with arthritis. And in my my impression of the data is that, again, low testosterone there's a paper I think in 2023 where it said that low testosterone increases your risk of arthritis, which makes sense when you look at the role of the hormones, particularly estradiol. But I've had patients stop their treatment because of arthritis, which was rather frustrating.
We should do it. There should be a podcast on stupid things doctors say, and we could include that in one of them. I mean, first of all, there's no plausible mechanism by which a naturally occurring hormone like testosterone would accelerate the development or worsen arthritis. Like, there's no plausible mechanism by which that could ever happen. The only roundabout way that a man on TRT would get worsening arthritis is that you feel so damn good that you go out and you put more mileage on your joints and you do more exercise, etc. And that's probably why my joints, I've got arthritis in my knee and my hip. I had a long military career. I sustained a bunch of injuries doing really fun and sometimes stupid physical things that that maybe I wouldn't have done. I wouldn't have had the energy to go out and do because if I was not on TRT.
Yeah.
That's the only way that I could think of that. And that was there. It's interesting you say that, because there was a paper out recently that it got a little bit of traction about men started on TRT within the first 6 months were more likely to have a bone fracture, a long bone fracture. And so there was some talk about that. And even in the paper, they said, yeah, it's because you're more likely to go out and be active and go ride your bicycle, go hike a mountain. Like, you're more likely to do things that would cause you to break your arm. It's not the testosterone causing it. So, that's absurd. It makes no sense. If anything, it would actually help when you combine it with exercise. You strengthen the support structures. I've been told I need a knee replacement for a very long time, but I'm doing extremely well with my knee, mainly because all of the support structures, and I make a point of reinforcing those with resistance exercise, stretching, etc. And so that supports the joint. And so I have way less issues with my knee than you would think when you look at the MRI or you look at the X-ray. And testosterone has there's a part to play for testosterone in that. So
100%. Yeah.
So that's still, I can't, that would drive me crazy too.
I had to get that off my chest.
That's just absurd. It's absurd. Yeah. But the roid rage thing, we should maybe touch on that if you have a minute. So that I have noticed guys don't bring that up as much, but their spouses do, because they've also heard that. And to cut to the chase, that's not a real phenomenon. If anything, men become more calm. They learn how to deal with adversity better. They're less likely to fly off the handle and become upset. That kind of behavior, that's low T behavior. A man with a healthy level of testosterone is able to handle adversity in a calm, cool, and collected fashion, and then organize their thoughts and then execute, a solution to whatever the problem is. The only way that I think it gets misperceived is that some men who maybe have had low T for quite some time, they have been sort of easy to push around. And if they've had sort of a domineering, like bossy wife, for example, now they just become a little bit more assertive. And then that's misinterpreted as aggression, or misinterpreted as some sort of a negative mood change. Or really, they're just sort of sticking up for themselves. They're just being more manly. I can think of one particular case with a man that I took care of a few years ago, and that was exactly what it was. He wasn't losing his temper. There was no roid rage. He just was not putting up with any more shit. And I think the testosterone had a lot to do with it, but generally no. And you and I have talked about this. Testosterone has made me a much better partner, husband, much better father, much better doctor, much better human being in so many different ways from an emotional standpoint. The benefits are there for many guys, and that's just a myth. And we're not talking about trenbolone here, right? We're talking about bioidentical, testosterone, and the body is used to seeing that. It has a positive effect on mood.
Yeah. I think the mainstay, what I always say to people, and I think you've summed it up well there as well, is that we're correcting a deficiency. So we should really aim to see, a lot of benefits in the areas of low T, which one of the symptoms is irritability, isn't it? And like lack of, poor stress resilience. So we get that better alongside good lifestyle. You should be in a better place mentally. Yeah.
And that is one of those things on the timeline that anecdotally, I don't know if it's ever been studied, but anecdotally, I do see that gets better early on in therapy. You don't have to wait a year to get those sorts of benefits. That happens. Like I said, all the CNS stuff seems to happen a bit more quickly.
Yeah.
So, but that's a big one.
The compounding effect, which is what I love about it, is you feel more stress resilient. You do the right things. Your life goes in a better direction because you can take on more challenges. You exercise more regularly. Huge benefits in that sense, and that's why
it's a force multiplier in military terms. It spills over into so many other parts of your life.
Yeah, and that's why we talk about that 6 weeks, 6 months, but 6 years, like Dave Lee says. I quite like that, because
Yeah.
you've got the force multiplier effect there.
Mhm.
Brilliant. Well, thank you very much for joining us.
Yeah, thanks, Max.
Really useful.
Yeah. There's still so many myths. We'll have to do a part 2.
We'll have to do a part 2. Absolutely. So just remind us where people can find you and follow you and reach out to you.
Yeah, I like I said, I've got a YouTube channel at Man Medicine. I try to go over mainly evidence-based health issues that are pertaining to men. You can reach me at manmedicine.com. I do practice telemedicine across 4 different states, but one of the best parts about my job in this realm is I get to do consultations, advice-only consultations with men all over the world. I really enjoy that. So if you're struggling with an issue in this area, if you want some general health advice or specific health advice, if you've got a medical condition, I'd be more than happy to try to help you with that. So looking forward.
Yeah, highly recommend the YouTube channel. Like I've said on this channel, very informative and
thank you.
Good stuff. Right. Take care of yourself.
All right.
Thanks for joining us.
Yep.
Thank you for listening to the Alphagenix podcast. Make sure to subscribe to the channel so you don't miss next week's episode. For more resources on Alphagenix and men's health, visit alphagenix.co.uk. Until next time.